So this skills session is going to cover MRSA swabbing techniques. So the techniques we're going to use today are going to cover MRSA swabbing for the nose and for the perineum. Now, in various clinical areas, these techniques may vary from institution to institution. So it's important just to observe your local policy guideline. So we have attended to our hand hygiene, we have non-sterile gloves and an apron. We have our appropriate documentation, which is the microbiology request form, which will be filled out in full. We also have sterile bacterial swabs. So it's very important to make sure that these are in date, and the date will be on the back of the packet. Also make sure the packet hasn't been tampered with and that it seems to be intact. And we also will be using normal saline to take the nasal and the perineal swabs. So the first thing we do is we explain the procedure to the patient in order to gain their consent and to ensure that they have a full understanding of why we're undertaking the procedure. So in order to take a nasal MRSA swab, we must moisten the swab first, and we do this by inserting it into sterile saline. We ask the patient to tilt their head backwards, and we insert the swab into the anterior aspect of the nose, taking a swab, rolling it around the nasal flares. And we also use the same swab and repeat the procedure in the left nostril. We then take the swab and we take out the transport tube and open the lid. We insert the swab into the tube and ensure that the swab sits in the transport medium. That's the nasal swab completed. In order to take the perineal swab, we again remove the swab from the packaging. We moisten the swab with sterile saline, and we apply the swab to the perineal area. This is the area in males between the testicles and the anus, and in the females between the vagina and the anus.